Shall we start the class?
Yes, sir.
Okay.
Yes, sir.
So last class we were talking about how we have been affected positively or negatively by COVID-19. Today I am going to take you to one of the important issues that is related to sustainable development goals, where health is a major component, and that comprises uh, ensure healthy lives and promote well-being for all at all ages. So this is the goal number 3, which talks about good health and well-being. So the end goal of health is to promote well-being. Though we are saying that we are healthy, but we're not sure whether there is well-being or not. So based on the sustainable development goal number 3, how health psychologists can contribute to this, I'll discuss it today. Sustainable development goal, as you all know, is framed in the year 2015, and we have to achieve the goals by 2030. And now we are in 2021. Last year, the entire year was a corona year. So before COVID-19, there was progress in many health areas that continued, but it needs acceleration. So the areas where we were working earlier was tuberculosis, child health, maternal health, HIV, and immunizations. But the current pandemic has interrupted childhood immunization programs in around 70 countries because of the physical distancing, lockdown, and containment. It was not possible to continue with the immunization program in and around 70 countries. So the implications of COVID-19 on healthcare disruptions could reverse decades of improvements. Hundreds of thousands of additional under 5 deaths may be expected and also happened in 2020. And the other implications are illness and deaths from communicable diseases will spike. Service cancellations will lead to 100% increase in malaria deaths in sub-Saharan Africa. Less than half of the global population is covered by essential health services. Now, during this pandemic, we couldn't address some of the health problems that were uh, requiring regular health checkup and medication, as well as consultation by the uh, patients with the physicians. That was interrupted. So we found many people have died not because of COVID-19, but other comorbid conditions that they were suffering earlier. It could be heart disease, diabetes, cancer, for which they were getting regular treatment that became irregular with this pandemic. With the systems in health sector focusing on COVID-19, many of these lifestyle diseases were not addressed properly. So let us come to see what are the targets and what are the indicators in this goal, Sustainable Development Goal number 3. So there are some 9 targets, and along with each target we have some indicators. So target number 1 is by 2030 reduce the global maternal mortality ratio to less than 70 per 100,000 live births. So our goal is globally, it is not at our country level, it is globally. Maternal mortality rate. Many mothers do die because of complications during childbirth. So the target is to reduce that number to 70 per 100,000 live births. When there are also complications when both mother and child do die, but when we have children alive and mothers to die, we need to be cautious about this ratio. So that was the goal and target. And how to know that what is happening at present? We can find those indicators from maternal mortality ratio. What is the maternal mortality ratio at present? Suppose for India, what is that maternal mortality ratio, and what are the causes for that, and how we can address those issues. Similarly, the other indicator for this target is proportion of births attended by skilled health personnel. So out of the total births, how many birth is attended by skilled health personnel? In other words, how many births are there in the hospital setup or by the uh, healthcare workers who work in the rural areas. So if we can find these two indicators, we can target how we would be able to reduce the numbers. Now coming back to target number 2, it is also called as 3.2 because health is good health and well-being is sustainable development goal number 3. So target number 3.2 is by 2030 end preventable deaths of newborns. Preventable deaths, this is very important. Like many deaths can be prevented, but it is because of our negligence, because of the systems are not in place, there is an increased death rate of newborns and children. under 5 years of age, with all countries aiming to reduce neonatal mortality, the newborn mortality, to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. So two targets are there. We want to reduce the number of newborn as well as under 5 age children death to 12 per 1,000. So to know that, we must understand what is the current scenario. How many children do die neonatal mortality at present, and how to reduce it. Definitely it is more than 12, so that is why the goal is given 12 per 1,000 live births. And similarly, under 5 mortality is high in the developing countries like India because of many reasons. And we must find out what are the causes of under 5 mortality so that we can address them and reduce the numbers to 25. So certainly at present it is more than 25 per 1,000 live births. So we need two indicators for that. How many people, how many children are there under 5 mortality rate, what is the under 5 mortality rate, and similarly what is neonatal mortality rate at present. Then comes target number 3.3. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. This is a very big goal to be achieved, especially in most of the developing countries. Achieving these goals is too challenging, extremely challenging. Epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, combat hepatitis, waterborne diseases, and other communicable diseases. Now, the communicable diseases is becoming a serious health issue for the entire world. And with COVID-19, it has made us more susceptible to communicable diseases. So what are the indicators? There is no such goals to reduce or something like that. We want to end the epidemics. So how to know what is the current status? So number of new HIV infections per 1,000 uninfected population by sex, age, and key populations. So we need to understand how many people are HIV infected. If 1,000 people are tested for HIV, how many got HIV positive by population? By population means the country's total population, and what is the percentage of that population who is HIV infected. Whether males are infected more or females are infected more. Which age group is more infected? And which are the key populations? Like in our case, we find the truck drivers are more susceptible, are more found to be HIV infected. So which populations, those migrant populations, they are more vulnerable to such situations. So we need to find out what is the number at present per 1,000 uninfected population. This is for HIV. Second is for tuberculosis. Similarly, per 1,000 population, how many TB patients are there? TB cases are there. For malaria also, per 1,000 population, how many malaria cases are there? How many hepatitis B incidences are there? And similarly, number of people requiring interventions against neglected tropical diseases. Different regions have different kinds of diseases. So any disease is there because of the environmental conditions or the tropical conditions of a particular place. So how many people are suffering from that? So this indicator will guide us how quickly we can achieve the goal before 2030 to end the epidemics. The way we fought COVID-19, because it was a never seen and never experienced kind of situation for many of us. And gradually we are coming out of this situation, and life is coming back to normal. Similarly, we are still fighting with the other epidemics, and we want to end them by 2030. Target number 3.4, by 2030, this is the target, uh, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. Now, we all have a lifespan. So the uh, lifespan of a particular country vary from the other country. Can we increase the lifespan of people by reducing premature mortality, 1/3 premature mortality? Most of the youngsters, we found that they meet an accident either by taking selfie or by rash driving, and most of the youngsters do die on road accidents. These days, it's more frequent. Can we do something to reduce the premature mortality? Because this is not a disease, and but the consequences are uh, very bad. So non-communicable diseases through prevention. What kind of prevention strategies we can take so that this should be reduced? Similarly, people who are suffering from cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases, these are also non-communicable diseases. So because of these diseases, many people do die prematurely. Can we prevent them? What kind of treatment are available? Can we treat them successfully? And also, at the same time, promote mental health and well-being of all. So how to know that? We need to understand the mortality rate attributed to cardiovascular disease. So how many people are dying because of cardiovascular disease every year? How many people are dying because of cancer? How many people are dying because of diabetes or chronic respiratory diseases? In addition to that, some other forms of non-communicable diseases, we can find it out. And the second indicator is suicide mortality rate. Now, whoever commits suicide uh, uh, is not all suicides are not becoming true. Like not everyone dies. The attempted suicide rate is high than the deaths. So we are uh, trying to see suicide mortality rate because of suicide, and suicide is a mental health issue. So how many people do die by committing suicide? That's an important indicator to reduce premature mortality. Then target number 3.5, that asks about strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. This is rampant in present society: substance abuse, narcotic drug abuse, and harmful use of alcohol. So the indicators are coverage of treatment interventions. So how we have reached, what is the coverage, pharmacological, whether the medicines are available for all of them, psychosocial, are there enough psychosocial and rehabilitation services uh, available for these people. We need to assess the situation, because not many of the cases of substance abuse uh, would be treated by medicine alone. We need psychosocial intervention, psychosocial rehabilitation, or aftercare services. And we do not have enough professionals in our country to take care of these cases. They often develop psychological illnesses and commit many different kinds of crime because of the drug abuse. So are we prepared with the workforce who can take care of these substance abuse disorders? So we need to find the current status of our uh, entire world, how they are being provided. Then the second indicator against this is harmful use of alcohol, defined according to the national context as alcohol per capita consumption. What is alcohol per capita consumption? Aged 15 years and older within a calendar year in liters of pure alcohol. So how many people aged 15 years and above take alcohol, and in a calendar year how many liters of pure alcohol do they consume? Based on that, we can find out whether it is harmful use of alcohol, and this is defined by the national context. And then we can plan the interventions, how we can intervene into this. Then target number 3.6 talks about by 2020, it's not 2030. Remember, by 2020, we have already uh, completed 2020. Half the number of global deaths and injuries from road traffic accidents. Well, we achieved that rate because there was lockdown. So deaths due to road traffic accidents and injuries are less. But now again, with opening of the roads and traffic, the deaths are increasing, as well as injuries are also increasing. So we need to see the death rate due to road traffic injuries and how we can reduce them. Can be through many ways. It could be like we can educate the uh, drivers who drive on the road. We can also have some system to be implemented by the uh, legal agencies or by the police. We can also ask uh, the manufacturers of vehicles to have some system in the vehicle, so that we'll get some feedback about our driving behavior on the road, and accordingly we can mend our road behavior. So there could be many things can be done to prevent death due to road traffic injuries. Then target number 7 or 3.7, by 2030, ensure universal access to sexual and reproductive health care services. including for family planning, information and education, and the integration of reproductive health into national strategies and programs. So, in the health and well-being sustainable development goal, good health and well-being, you must have found by now most of the targets are behavioral interventions. Mostly they are talking about the preventive aspects. And that is also true in case of sexual and reproductive health care services. One need to be aware of the family planning things, information and education, and integration of reproductive health into national strategies and programs. So what are the indicators? They are the proportion of women of reproductive age. How many women are there in a country who are aged between 15 to 49 years, who have their need for family planning satisfied with modern methods. So they must be educated. And here I would also like to add one point which is not in this indicators. It is not about women only. The men should also be educated about family planning and the modern methods. Then comes the next indicator in the same target, adolescent birth rate. How many 10 to 14 years aged and 15 to 19 year aged uh, adolescents give birth uh, from 1,000 women in that age group. Suppose 10 to 14 years, 1,000 women, 10 to 14 years girls or adolescents. How many are pregnant out of these 1,000? Similarly, 15 to 19 years, 1,000 uh, adolescents, how many are pregnant? So how to uh, educate them? And we must uh, give some kind of awareness training at the school level. It is not in the college, rather at the school level, it should be started so that there would be universal access to sexual and reproductive health care services. Coming to the next target, that's 3.8 or 8, achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. So universal health coverage, when we talk about this, we talk about all kinds of policies, health policies, which include the financial risk, because there are many families who are ruined because of serious illness of one family member. And if that family member is the breadwinner, then that becomes very difficult for the family to sustain after the individual suffered from an illness which requires a heavy amount of money to be spent for treatment. At the same time, are we able to access quality and essential healthcare services, access to safe, effective, and affordable essential medicines and vaccines? Because most of the hospitals these days are they try to make money out of someone's helplessness. So in this situation, how we are going to give a universal health coverage to everyone? So to understand that, the indicators could be, what is the current scenario? Coverage of essential health services. How many people are having that essential health services? This is defined as the average coverage of essential services based on tracer interventions that include reproductive, maternal, newborn and child health, infectious diseases, non-communicable diseases, and service capacity and access among the general and the most disadvantaged populations. In many of the health policies, you would not find that aged people are not being given priority, whereas people in their uh, active period, they are encouraged to uh, buy a health policy. In fact, people after a certain age need more health care, but the health policies are not enough to help those populations, mostly the geriatric population, who are uh, suffering from many uh, forms of non-communicable or communicable diseases after the age of 60. They are the least addressed population. We don't have any answer why it is so, why those population is not being taken care of. We do not have a policy for aged populations health care. Then the second indicator within this is proportion of population with large household expenditures on health as a share of total household expenditure or income. So how many people with a large household spend more on health as a total household expenditure or income? You'll find that many people are on a regular medication these days, and mostly the aged ones. I mean, throughout their day and even at nights, they must be having some kind of medicines or the other. Their day starts with medication and ends with medication. And not all medicines are reimbursable, or not all medicines are available through a social security system. So what happens? They spend that money from their pocket. This is an extra expenditure for them. When you are spending more on health, you are neglecting other aspects of life also. So this becomes a burden. How to reduce that burden is the target. Then target number 3.9 or 9 is by 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and containment. This is also a big job to be done. Substantially reduce the number of deaths and illnesses from hazardous chemicals and airs. We know the air pollution levels of all the cities, at least in India, we know, or maybe the global level, we are all aware of how poisonous is the air, water, as well as the soil. How to reduce them. To know uh, their uh, their condition, we can indirectly see mortality rate attributed to household and ambient air pollution. How many people die because of air pollution? Now the statistics have started coming. We know in a particular year, these many people have died because of air pollution in a particular city. Then 3.9.2 talks about mortality rate attributed to unsafe water, unsafe sanitation, and lack of hygiene. Exposure to unsafe water, sanitation, and hygiene for all. We call them WASH. Water, sanitation, and hygiene for all. This program, is it working everywhere? Do we get safe water and sanitation is there, or hygienic conditions are there? We are talking about SMS. In that we have one is that sanitize. You sanitize your hands too frequently. Why it is necessary now? So we know the importance of sanitation in our lives. Then the last one is within this target 9.3, 3.9.3, mortality rate attributed to unintentional poisoning. Many times we do not know what does it contain, whether the water or the soil from where the food is coming, and we unintentionally poison our bodies, and because of that deaths do occur. How to reduce that death? Then we have some additional targets. They are 4 in number along with their own indicators. So that is 3A, which talks about strengthen and implementation of the World Health Organization Framework Convention on Tobacco Control in all countries as appropriate. Tobacco control. We must work to control tobacco use based on WHO framework. So the indicators are age standardized prevalence of current tobacco use among persons aged 15 years and older. So we need to see how many people aged 15 and older are using tobacco currently, the prevalence, so that we can target a specific population. If they are using it more often, we can plan interventions for that. Support 3B talks about support the research and development of vaccines and medicines. Now vaccines for corona has coming up, and our country is ready for vaccination. For the communicable and non-communicable diseases that primarily affect developing countries, provide access to affordable essential medicines and vaccines in accordance with the Doha Declaration of the TRIPS Agreement and Public Health, which affirms the right of developing countries to use to the full the provisions in the agreement on the trade-related aspects of intellectual property rights regarding flexibilities to protect public health and in particular provide access to medicine for all. So this declaration is a declaration which uh, takes care of the human rights for health. So all the countries are uh, developing the vaccines and medicines based on these declarations. The indicators in this is proportion of the population with access to affordable medicines and vaccines on a sustainable basis. So now this COVID vaccine that has been uh, developed, we came to know from the news that it is going to be given freely to uh, uh, Indians. So similarly, what is the proportion of population are getting affordable medicines and vaccines on a sustainable basis? Why it is sustainable basis? Because one dose of vaccine will not do the prevent the diseases or the infections. So you must get the full dose of vaccine, be it 3 times, 4 times, or whatever, as mentioned by the uh, researchers or developers. Are we getting them, or how many of us do get them or not? Then the next indicator is total net official development assistance to medical research and basic health sectors. So how much we are spending on medical research and basic health sector, that is also important. Then target 3C talks about substantially increase health financing and the recruitment, development, training, and retention of health workforce in developing countries. We know that in our country, we have employed ASA workers for this job at the grassroots levels, especially in least developed countries and small island developing states, as well as in India as a developing country. We need them because people from the remote areas can't visit the hospital or health centers. So we need to provide services at their doorstep. And for that, we have a strong network of the ASHA workers. So to know whether we are doing it successfully or not, the indicator is health worker density and distribution. So population wise, we can see how many health workers are there in which regions of the country, and where it is less or where it is more. Accordingly, we can again redistribute them. Then the last target, 3D, is about strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. This is about awareness, how quickly we get the information. So we know in the many disasters these days, we are getting early warnings, be it cyclone or like um, heavy rain or any kind of natural disaster. We are getting an early warning so that we are reducing the risk by migrating people to a safer place and manage the loss, because that, if not controlled, we will be again spending a lot of money to treat them. And the indicator is international health regulation, IHR, capacity and health emergency preparedness. So there is a regulation uh, according to that how we are prepared for health emergencies. During the corona period also, we have seen some of the cyclones and we have managed them very well. So likewise, in some of the areas we are doing well, and in some of the areas we are still behind. And how those health issues can be addressed and can be taken care of for promoting health and well-being for all is a matter of concern for everyone. And so far as the indicators and targets that I discussed, you would have noticed one common point among all is that the statistics, the data, that is more important, which is not available in its correct form. So if you can make some system to get the data correct, at least the authentic data, then many things will be streamlined. Now, suppose I am just giving a last example before I end this class. Uh, in a particular area, we are finding that there are children having a particular kind of disease, and the density of pediatricians in that particular area is very low. So if we came to know based on some real-time data that there is some rise in a particular kind of disease among the children, we can shift pediatricians from other places where there is not that much demand. Will not take all the pediatricians, but some of the pediatricians can be shifted for a temporary time to that location where we need them the most. And that is how we can address this issue quickly, and they can come back. Similarly, if we are getting infections in a particular area, more infections are happening, so we can send specialists to that area at least to contain or control that infection, and then they can come back to their original places. But how to know that if we do not have a real-time data available with us? And with that, we must see the trend, how the trend is changing from here to there. In India, we have one of the biggest problem is that we do not have any kind of documentation done properly. So documentation is one of the important issues of our country, where technologists like you can play a vital role. So now in this class, I'm orienting all the technologists to come up with new plans and programs, or maybe your thoughts and ideas. If you are talking about um, the startups and whatever, we are looking for many things, and there is a huge demand of these technologies in our country. So let's come and do something for the betterment of our country. Thank you. Any questions? Any questions? No questions?